Tusla is currently developing an alternative care strategy with partner agencies including the Irish Foster Care Association. This plan details how it will improve alternative care over the next 5 years. The aim is to create child-centred and innovative foster care services. To gather the views of foster carers and social workers, the Irish Foster Care Association and Tusla hired Quality Matters, an independent charity. Over 6 months, they surveyed 387 people and spent 60 hours at 16 consultations talking to over 300 foster carers and social workers. Working together, social workers and foster carers found that they were affected by the same problems in different ways. They had more in common than not. Social workers and foster carers agreed that making a difference matters, and that by working together, real change could happen. The discussions identified 37 suggestions for how the current system could be improved across 5 thematic areas, including culture, capacity, policy, technology, and systems. Suggestions ranged from small-scale changes to much bigger ones, like the introduction of a travelling family court and building new family-friendly facilities for access visits. Every suggestion raised by 3 or more people is outlined in the full report in detail and in brief in the summary report. So what are some of the key suggestions? A key theme was the need for a cultural shift. While many foster carers highlighted a good relationship with their social workers, it was agreed by the majority that communications and relationships could be further improved. They said that training in leadership and culture within Tusla and regular opportunities for social workers and foster carers to come together to understand each other would really help. To drive change and ensure transparency, a survey should be carried out every 2 years with all foster carers and social workers to check whether culture, morale, and workload are improving. The culture people want to create is one of openness, fairness, and above all else, one based on partnership and respect. Everyone agreed that a big contributor to many challenges was that 38% of social workers felt that they did not have the time to communicate with the foster families they supported. There is a need to increase staffing levels to ensure there are enough social workers and admin staff to do all the work required and to support additional foster carers. Foster carers and social workers agreed that things happen differently across regions and they would like more consistency. Standardised implementation of policies and procedures needs to happen. Technology can be improved to ensure staff have access to information when it's needed wherever people are. There are many specific suggestions for how pieces of the system can be improved. One important example is the need to provide a full range of accessible mental health supports for foster children. Another example is the need for birth children of foster carers to be able to access counselling when it's appropriate. At the end of this process, everyone agreed that change needs to happen. There are 37 suggestions identified. These will all be considered as part of the development of the new strategy. This strategy will provide a real opportunity to improve fostering services for children, families and workers. To those who gave their time, hopes and ideas, the Irish Foster Care Association and Tusla would like to say thank you.